Next on our informal agenda is a health plan recommendation. Steve Ashe from HORAN Associates.
Morning, Commissioners. Bob Sander, Human Resources. 3 weeks ago, we came to you with an update for 2016 healthcare, and we want to continue that process of updating you. And as Commissioner Humphrey mentioned, Steve Ashe, who is with HORAN, our healthcare partner, is here to give you an update of where we are.
Thank you for having me out, Commissioners.
Good morning.
Before I jump in, I also just want to say thanks to HR as well as the Healthcare Advisory Committee for all their hard work over the past few years. You know, a lot of work goes into these renewals, looking at different alternatives. It's very appreciated on my end. So just like years in the past, this year's renewal, a lot of hard work has gone into it thus far, and we're here to give you an update. Here's the agenda. It's very similar to the last one. Quick update on the medical claims. We'll talk about the 2016 medical renewal, an overview of all aspects that go into that. We'll talk about some plan changes that we had discussed with the Healthcare Advisory Committee as well as HR. We're going to look at the employee and county contributions this time around, the 2016 dental renewal, as well as 4-tier rates. We're going to look at vision 4-tier rates, the 2016 ancillary renewal, so the long-term disability, basic life, and voluntary life plans. Also an update on the worksite voluntary benefits, and then the primary care program initiative as well. Quick update on claims year to date. Things are running fairly well. We are at 85% of our expected costs right now through July. So that is good. We are running under where we projected we would come in at. So the renewals, Humana Administration and stop loss renewals. Administration, Humana did offer a rate hold. So there was a cap in place that was negotiated last year. However, with further negotiations with them this year, we were able to get them to not even come in at that cap, but actually offer a rate hold, so we were happy with that. From a specific deductible stop loss premiums, Humana offered a 5.9% increase. The next few bullets just give a little bit of history on the large claimant payouts that we've had. 2015 year to date, there have not been any payouts, so that is one of the reasons they came with a pretty competitive stop loss renewal at 5.9%. Typically, you can see those around 19 to 20% just on leverage trend alone. We are currently conducting a full market bid to ensure Clermont County is receiving the best stop loss. So we are checking the market for the stop loss premiums. From an aggregate stop loss standpoint, Humana offered a 3.2% increase. After meeting with HR and the Healthcare Advisory Committee, the recommendation is to renew with Humana Administration and evaluate the stop loss market and make a decision after that. So we are set to meet here in about a week to review the stop loss proposals that we're putting together to see if there's any other viable options. Quick update on healthcare reform. The county will continue to pay the transitional reinsurance plan fee. You know, bad news, it's still there. Good news, it did go down. Patient-Centered Outcomes Research Institute fee, that did increase slightly. And then I just give the overall average of about $110,000 in the taxes and fees. The other thing in healthcare reform is Clermont County is going to be responsible for what is called 1094 and 1095 reporting requirements. The first part of that is due January 31st, 2016, and that's going to be something that's going to be sent to the employees. And the second part is going to be March 31st, 2016, and that is a transmittal to the IRS. So really it's reporting requirements to ensure that you're offering minimum essential coverage, it's affordable, which we've done analysis on that, and it is, and that you're offering it to all full-time employees, which you are. So it's really just a reporting requirement from healthcare reform. The reporting is based on your 2015 plan year enrollment, which is why we're giving you an update on that right now. One other change is currently Ohio requires medical coverage to be offered to dependents up to age 28. There was a bill passed earlier in 2015 that is going to bring that age 28 back down to age 26. So age 26 really matches the federal age guidelines. So what happened is when healthcare reform came about, I think it was probably 2012 or 13 when they made the change to move most people covered full-time students up to age 21, 22. Federal guidelines said age 26 is where it's going to be. At the same time, Ohio passed a law that said it's going to go to age 28. So it was kind of happening at the same time. I think it was a little confusing when it happened at the same time, and Ohio has since come down to age 26 just to match federal. So that'll be a change as well. This next slide goes over the total costs. So right now, I was out here last time, we were showing a 3.2% increase. We did update our claims projection, and it's actually decreased slightly to a 3% increase for 2016. That's about $341,000, and this is the final projection for 2016 that we'll be basing all the contributions off of. I give you each line item between administration, stop loss, etc. And then again, the total, you can see the 2015 annual, 2016 annual, the 3.0% increase, which is the $341,000. So medical plan changes, like every year, we look at various options. We either hear things that employees may want us to look into. We look at other options to help reduce costs. So we did that just like years in the past. We look at these with HR as well as the Healthcare Advisory Committee. We did discuss several changes. One of them was adding a third option, another higher deductible, consumer-driven health plan with higher deductibles. We decided we did not want to go that route for 2016. We also looked at a few others, TMJ coverage, covering hearing aids, cochlear implants, and then speech therapy visits, actually increasing those. What we did when we looked at all those changes is we then went to Anthem and United Healthcare, who are the other largest players in this area, to see how they cover those types of services. So we really just benchmarked how those are covered. What we found is Anthem and United Healthcare cover them very similarly. They cover them the exact same as Humana. The one where Humana was kind of the odd one out was cochlear implants. Anthem covered it, United Healthcare covered it, Humana did not. So after discussing that with the Healthcare Advisory Committee, we felt that we wanted to include the cochlear implants, and the recommendation is to include that for 2016 because the other larger carriers include those. TMJ, they don't cover. Hearing aids, they don't cover. And then the speech therapy, they cover them at the 20 visit limit. Anthem and United Healthcare. Humana also covers it at the 20 visit limit as well, so we felt that based on that, we'll keep it at the 20 visit limit.
Steve, I thought I read yesterday in an email that the cost to increase it in terms of doing the hearing aids as well as more of the speech therapy visits is rather insignificant, even though it's above and beyond what the other carriers are providing. We're in line, but we could increase it, and the cost is rather insignificant. Do you know how much insignificant is?
I can't tell you exactly what it would be. Probably $5,000, $10,000, and it would depend on utilization and the visit limit. But yes, we did try to go to Humana and say, if we increase the limit, how would that impact the claims? And what they do is they give us what's called a decrement. They said the decrement is insignificant, that we can't provide. We're not going to give you a decrement just to increase that. So I can't give you the exact dollar amount to increase it, but one of the things that we did look at is we looked at Warren County. We looked at the Centers for Local Governments, a lot of different school districts as well. They also have the 20 visit limits. Some of the school districts went from 20 to 60 for speech therapy, so that was the highest range that we saw. But we felt that increasing it, because we're kind of matching the benchmarks right now, we felt if we increase the speech therapy, maybe in future years something else will increase, and you kind of just expose the plan a little bit more to additional claims. So the Healthcare Advisory Committee thought it was safe to keep it where it was at.
And with hearing aids, I know we've got a lot of employees that have hearing aids with the aging population.
Yep.
And that's not something today we reimburse for. Is that
correct?
What would the cost of increasing that?
Adding hearing aids.
Allowing that option.
Yeah, adding hearing aids with the limitation, I want to say, was maybe around $60,000 to add the hearing aids. They did give us a decrement for that one because it would be significant enough.
That is significant, yeah.
Yes.
Now, on the speech therapy, I know there was even a suggestion, maybe, is there a possibility to combine physical therapy visits, which are 60,
Yep.
and the and the speech therapy at 20 to make it 80 visits, and then dividing up which one is.
Yeah, no, so great question. And I've actually reached out to Humana to see if they could administratively do that. So some will do a full combine and say, we're going to give you one lump sum of visitations. Whether you use it all for physical therapy, whether you use it all for speech therapy, it doesn't matter, but you have one lump sum of, say, 80.
That would make sense.
Yep, so I'm checking. Some carriers can't administratively execute certain things, so I am checking with Humana right now to say, hey, administratively, if we wanted to bundle it, could you do that?
Okay,
So I'm checking into that right now.
good. Good, thank you.
You're welcome. But again, the recommendation from the Healthcare Advisory Committee is to include the cochlear implants because that's kind of currently the one that is unique that it's not covered. The next page goes over the employee and county contributions. So myself, as well as our financial analysts, met with the Human Resources team to look at different options, as well as Healthcare Advisory Committee, looking at different contribution scenarios. This year, you need to keep in mind the employees that participated in that primary care physician initiative are actually going to receive a discount to the rates. You can see the recommendations are listed below. The first box is the consumer-driven health plan. You have the tier coverage, so single, employee, spouse, employee, child, family. Next, you have the county share. We then show you what the employee share would be for the non-primary care physician participation. So for example, the single would pay $27. Just to the right of that shows you what that increase would be over current. These are per pay. So the employees would pay an additional $5.04 if they decided not to participate in the primary care physician initiative. Over there in the green, this shows what they would pay if they decided to participate in the primary care physician initiative. Single, they would pay $22, so it would be literally a 4% increase for those employees.
4 cents.
4 cents. Oh, did I say dollar?
I thought you said percent.
Oh no, yeah, it's $4 or 4 cents. So as you can see, for those employees that are participating in the primary care physician program, they can really reap the benefit of doing so, and we wanted to reward them for that. Same with the NPOS down below. As you can see, it's the same setup. You see the dollar increase for non-participants, so those are going up, and then for those that did participate, it's pennies for most, and then family it is $5.34. Those are the recommendations for the contributions for 2016.
And to keep it at a 4-tier.
Yes, yes. We want to keep it at a 4-tier, which kind of brings me to my next point. We have the dental renewal and the dental contributions as well. The good news with dental is we are projecting total cost to go down about 2.5% or $13,000. And then the recommendation for the dental is to move to a 4-tier at this time. So right now the dental is under a 2-tier structure. You only have single and family enrollment. We recommend breaking it out to single, employee, spouse, employee, children, and family to match the medical and to provide options for employees. Right there you have the current rates and the renewal rates. As you can see, they are decreasing slightly. And then we have what it would go to the 4-tier rates. So the single would stay the same. Oh, not stay the same, it would actually decrease from current. It'd go from $13.04 to $12.71. And then you have those employee, spouse, employee, children actually paying less than they are today, and the families would pay a little bit more than they are. So the majority of the employees for 2016 that are enrolled today would actually pay less, moving to that 4-tier structure. So that's the dental. The next is the vision. Vision is currently under rate guarantee, so no premium changes. We're just looking at recommending, or we do recommend, move to 4-tier rates just to match the medical and the dental. And you can see the breakout there again as well as the current enrollments. By changing the dental and the vision to the 4-tier, medical's already under that, so it's a consistent, easy message to the employees. Everything's on a 4-tier basis. I do see the majority of the groups that I work with on a 4-tier as well, and it provides them choice. Any questions on the medical, dental, or vision so far?
Steve, you're recommending to keep the HSA?
Yes, sorry, I think, yeah, I didn't touch on that, but yes, keeping the HSA contribution where it is today, which, yep, continue with the 600, 1,200. Thank you. The next thing that we did was your ancillary lines of coverage, so the basic life and AD&D, voluntary life and AD&D, and long-term disability plans were up for renewal this year. So we did go and do a full market bid with all of those lines of benefits. Voya did come back with their renewals. Initially, they offered a rate hold on the basic life. After discussing the competitive data with them, they did offer a 6.25% decrease, which is about $1,800. So not a significant dollar amount, but they did reduce where they were coming in at. Their voluntary life, they're given a rate hold, so they're going to keep the rates as is. The long-term disability, though, is increasing fairly significantly, a 33% increase. It equates to about $6,800 annually on the LTD. So with the life decrease, the LTD increase, we're looking at essentially a $5,000 increase from Voya. So again, we conducted a full market bid for all these lines of coverage, and Symetra actually provided the most competitive quote. For the basic life, they're actually offering a 15% decrease. Voluntary life and AD&D, they matched current rates. In the LTD, they're actually offering a 14.4% decrease. So overall, it's an annual savings of $7,553. One of the other things that we asked from Symetra, we wanted to make sure that we were able to lock into these rates, for more than 1 year. We didn't want us to give low rates and then come back the next year. So they did offer 3-year rate guarantee. So we would be locked into these rates for 3 years. So over a 3-year time frame, it would be a $22,000, little over $22,000 in savings from current. So our recommendation is to change ancillary carriers to Symetra effective 1/1/16.
Stephen, all the coverage would be the same, right?
Correct. They match the current benefits that are on the plans. Next is the worksite voluntary benefits. So HORAN HR and the Healthcare Advisory Committee explored offering 2 new voluntary benefits in 2016, really for 3 main reasons: to just enhance the current benefits package that's offered to employees. These types of plans also complement the current wellness program that's in place, and they also complement the consumer-driven health plan where we have over 25% of the employees enrolled. So we looked at as offering on a voluntary basis, so 100% employee paid, a critical illness plan and an accident plan. The critical illness, the employee would enroll at a $15,000 coverage that is paid out if an individual has a specified critical illness. The other really nice things about these, and I mentioned they complement the wellness program. If a covered individual receives a biometric screening, they'll get $25. If they then also have a routine checkup, they'll get $50. And then after they have that routine checkup, if they do a follow-up with a primary care physician, they'll get another $50. So there's $125 of a possible payout that can be earned really for just maintaining your health and taking care of yourself on this kind of a plan. So it's a really nice benefit.
Steve, you mentioned too that about a covered individual incurs a specified critical illness. I mean, how comprehensive are the specifications?
There's a fairly comprehensive list. I mean, it's your critical illnesses, so you can think of cancers, strokes, heart attacks, like MS, certain critical illnesses. And there would be a list that we would share with employees before they'd sign up to say, listen, here's the ones that you're signing up for that would pay out. So they would know exactly what would be paid out.
Okay. Thank you.
Hey, Steve, on the biometric screening, maybe I'm thinking of something else, but that's basically, it looks at your genes and determines what is
Right?
It's
the biometric would just be a blood draw, and then they're
Is that
looking
it?
at your cholesterol, HDL, LDL, all that.
Or am I thinking of genetic?
Yeah, there's like a genetic testing, which you can't, you can do that, but yes, you're thinking of genetic testing. Yeah. So this would just be the biometrics, kind of your basically standard blood work. So that's the critical illness plan. Again, it's also really nice because you get that $15,000 of coverage if you were, say, in the high deductible health plan. All of a sudden you have cancer. How am I going to pay for the deductible? Well, you get a lump sum check, $15,000 just for having that diagnosis. And you can use that $15,000 to pay for your deductible. You can use that $15,000 to pay for maybe something that's not covered under your medical plan, but you want to try it. You could use $15,000 to take a vacation, to relax with your family. So you can do anything you want with that $15,000.
Could you put the 15 into your HSA? That makes
You might be able to portion of it because you can only max out your HSA to a certain threshold. You can only put a certain amount of tax-free in there. So I guess you
1,000 per family or something like
somewhere around there, yeah. So you could put some of it in there and then kind of do your taxes in the back end. The next plan is an accident plan. So really what this is there's the fee schedule that pays at a flat dollar amount based on the type of service or accident incurred. So say you have to go to the ER, there will be say a $200 benefit that will pay out if you just go to the ER. We find these really popular with people that have kids, accident prone. I know we offered this at HORAN. A lot of the people with children signed up for this immediately. The other really nice thing about this is the covered individuals will actually receive $100 if they have a preventive service. So if you go and have a preventive checkup, you mail that away to the carrier of choice, they'll actually just mail you a check for $100. Again, that $100 can be used for whatever you see fit. So we did conduct several finalist meetings to determine the vendor of choice. The vendor that we decided was the best based on rates, benefits, and service capabilities was Trustmark. And the recommendation is to offer the critical illness and accident through Trustmark to really round out the benefits package and complement the other programs we have in place. And also an update on the primary care physician program. Really, we put this in last year to encourage individuals to receive their wellness exams, physicals with their primary care physicians, and just build those relationships. A healthier workforce, it's going to be a happier workforce, less claims, less days off. There's a lot of good that comes with it. Also, building that relationship with the primary care physician is very important, so they can help, again, advise you on your health, etc. So we put this strategy in, and that's just a quick recap of the strategy. The below is the timeline of that strategy. So there is still time for individuals to turn in just the signed primary care physician form to get credit for the discounted premiums. They have up until October, or the end of September. Or actually, sorry, through October. I was correct the first one. And that's the timeline that we used last year. I kept that in there because our recommendation is to continue with this primary care physician program. Use the same timeline, obviously just different years, and then continue with the same medical discount or medical premium discount as we have today. So really just continuing this program the same as it is. Year to date, we have 40% employee participation. We expect that to go up in this next month and a half as the deadline gets a little closer. Any other questions?
Let me back up to the voluntary benefits.
Yes.
So there's a cost associated with each of these. Have we identified what the cost is going to be for each? I
Yeah.
see that in the presentation.
Yeah, so there are costs associated with these. It's 100% voluntary. It's based on the employee and their age.
Right.
So we can share a bracket for each of these.
Okay.
Yeah, that can be taken away.
Yeah, we'd like to see.
Yep.
Okay. Any other questions?
Bob, what's our time frame now?
Our next scheduled meeting with the board is on the 23rd, and we will ask at that time you all to make a decision, yes or no, and we'll have the answers to some of the questions that you posed at that time.
Okay.
And the very latest, we would like to see this approval will be the end of September 9/30. So we have really two more chances, the 23rd and the 30th.
And open enrollment would begin?
Open enrollment is going to start November 1st and go for about 2 weeks. That'll give us plenty of time to get all the enrollment in and ready to go.
Thanks.
Any other questions?
Good job, Steve.
Thank you.
Thanks, Steve.
Anything else for informal session? Okay, then that concludes our business for today. Thanks for joining us, and God bless.